Welcome back. This is episode 2 of Unmasked Health. And just to quickly recap, kind of about from the first episode, we kind of discussed or I brought attention to kind of what low testosterone is, or low T, better known by the male population, um, and what it looks like. So I kind of wanted to delve more off into what those symptoms are specifically and what are your different treatment options. So we know that testosterone is what gives you energy, what gives you muscle mass. Of course, it is, about your sex health also, but that's not just that. It's not just about how you perform in the bed. Low testosterone affects your brain and how you think. Are you able to concentrate? So it also changes your mood a little bit. Again, in first episode, I talked about, how some men are more depressed, or they can have like different outbursts or whatever. And that is, it can be a direct side effect of low testosterone. So why does it happen? Why do men and women, even women, face this problem once we go through menopause, or we have, fertility issues because of like polycystic ovarian syndrome? But why is it low? Why does our testosterone drop? So again, from episode 1, we talked about how it naturally starts to decline about 1% after the age of 30. But for some people it can drop faster and it can drop harder, and you wake up one day and you're like, something's off. I feel totally whatever. And men, ignore it for a while, or hopefully the woman in your life or your significant other will tell you, hey, you got something wrong, dude, and I'm going to need you to go to the doctor. So some of those reasons can be all talked about, but nobody wants to hear about, is obesity. The more abdominal fat that we have, the more you're prone to having low testosterone. And I'll explain it this way, like I do to patients who have low vitamin D3, low vitamin D. It affects more of our obese population. The more adipose tissue, which is fat, the more of that your body has, the more area that medicine has to work over, right? Or your supplement or your vitamin D and your body has to work over. And there's only so much that your body will make. And so if you've got a large body mass, you're eventually just going to run out of gas, I guess is how we can say it. So we have to supplement those. That is the reason why our obese population are low in testosterone. The other thing is diabetics, are those with chronic kidney disease. Not only are you taking medicines that can affect, your natural hormones in your body anyway, or you've got poor kidney function, so you're not able to supplement like you should anyway, or you're not able to eat certain foods, or you're not trying to, kidney function can impair a lot of our medicines that we intake, a lot of the type of food that we eat. And that's the same way with diabetics. And so that's another cause of it. So diabetics, males, if you're listening, women, if you're listening and you're diabetic or you've got some kidney impairment and you are feeling some of these symptoms that we're going to talk about, then let's get our testosterone checked. The other thing is, are you already taking an antidepressant? Part of my podcast is about men's health. And not that everybody needs a pill or anything, but most of us are walking around medicated, and there's not a thing wrong with that. Okay, this life is hard. I'll be very frank. I'm medicated. Both my sisters are medicated. And my husband needs to be medicated, but that's like pulling teeth, like it is with most men. But anyway, prescription medicines like antidepressants can affect your testosterone. Also, even if you are um, drinking alcohol, eventually, I know that a lot of people, or a lot of our population who does occasionally drink, socially drink, 3 to 4 beer a night, or a toddy at bedtime, whatever, that eventually may catch up with some of us and affect our testosterone level. So some of those symptoms that you really want to pay attention to are, what is your sex drive? Like, what is it low? Is it normal? Is it abnormal? Has it changed for you? And then what about the erectile dysfunction? Or Are you able to get an erection? Are you able to maintain an erection during your sexual episode? Then we have increased fatigue. Fatigue is a big complaint that we get from our males in practice. Is that, 6 months ago they were fine, now they're not. Loss of muscle. Yes, as we age, we become less active, and we shouldn't. We should remain active all the time. But we do lose our muscle mass when we lose our testosterone. And then you look at brain fog. We've talked about that. Unable to concentrate, unable to recall things that you used to could recall, and depression or irritability. I just had a guy last week that came in with extreme mood, up and down, waxed and waned all the time, no change in work, no change in work and home environment, and his testosterone was very low. Um, and then we have to look at, have you recently had weight gain? I mean, some of us, right, we get married or we get in new relationships or we take on a new job or life is not good. We're stress eaters. And so we tend to eat the bad things because it makes us feel good, right? Especially if you're in the South. We feed from the heart down here in the South. And so we think that makes everybody feel better. But what we need to do is let's not just guess. So you shouldn't be spending more of your time just guessing, hey, is my testosterone low? Well, if you're listening and any of this sounds like you, it's probably low. So go get tested. Again, do it before 10 o'clock in the morning. I don't care what anybody else tells you, that needs to be tested before 10 o'clock in the morning. Don't just guess. Go get tested. Find somebody that you trust that you can open up to. If you like your provider and you trust your provider and you're comfortable with your provider, ask them to check your testosterone. And of course, again, like from the first episode, there's going to be some more labs that will go along with that, like your estradiol, FSH, your LH, your PSA, for sure your PSA. And let's talk about your treatment options for low testosterone. The mainstream treatment are weekly injections, and sometimes in rare instances, males have to get injected twice a week. You split the dose. Let's say that I have somebody that's getting 200 milligrams, but by day 4 or 5, they're really starting to feel like, I don't feel as good as I used to. So we just split the dose, 100 milligrams at the beginning of the week, 100 milligrams at the end of the week. Totally what you want to do. And then there are gels. I do not do gels. I will give you a reason why I don't do gels. That transfers to people around you. It can transfer to your children. It can transfer to your significant other. And it's just not good. I think it's more risky than it is beneficial. Also, there's patches that you can use. However, patches do come off, especially our men. Y'all are hard workers, blue collar men. Even if you're not, you're in the gym sweating, whatever, and those may come loose. And then there are pellets. Most people prefer pellets. You go and get the pellets, and they can be changed every 3 to 6 months. And usually what I see in my area is that they get them changed about every 3 to 4 months. The only thing with the pellets is that we don't know really realistically how much of that you're getting over that 4-month period. Are you getting it all within a 1-month period? Or is it just a gradual, just a steady little wave of release of the hormone that you're supposed to be getting steadily over that, 3 to 6 month period? And I've had a couple of men and even women who had pellets in the past and came in and were like, it just doesn't work well. I just don't like it anymore. And I feel good for about 2 weeks after I get them changed, or 4 weeks. And then I'm just back to my normal symptoms of being tired all the time and I can't think straight. There is the more or less known, which are nasal sprays. I don't recommend those either. I think that the most effective and the one that we can monitor the best and we can adjust the quickest and the most effective and the most efficient are injections. But take that up with your provider, talk to your provider about that, and come up with a treatment plan that you're willing to do. That fits your lifestyle, and what you're comfortable doing, because it's your body at the end of the day. The other thing is there are some non-testosterone replacement therapy. There's just hit or miss on the research that's out there. Stuff like zinc, magnesium, vitamin D. Of course, if you know that you're low on vitamin D, that kind of stuff, we all need supplements because our food is junk. We're not out in the sun like we should, and if we are, we've got sunscreen on. If you're a good stewardess, person, you've got your sunscreen on. But there are some like TRT uh, replacements that we can do, to kind of boost that. But do your own research always. That's what I tell my patients all the time. Do your own research. You know, arm yourself with knowledge and take it to your doctor, because that gives you a one up, knowing more than what maybe even your doctor knows or your nurse practitioner. Um, and then, of course, lifestyle changes. Lifestyle changes for anybody. I don't care if you do have low testosterone or you don't have low testosterone. We are all sedentary. We're more sedentary than we should. Take it from somebody that, I sit and chart a lot, and, I do walk frequently, but now I'm in the gym, 3 to 4 times a week. We have to lose the weight. I know that that's not something that nobody wants to hear. Um, and it's hard to hear that, but as somebody that used to weigh almost 400 pounds, I have a hard time even telling my patients, hey, just go lose the weight. That's not what I do. I spend quite amount of time with people to give them the tools they need in order to lose that weight effectively. You need to make sure that your thyroid's not messed up. Is that a reason why you're not losing weight? But do your best. Research what works best for you. The Mediterranean diet is what I do, or not really a diet, but raw veggies, lean meat, that kind of stuff. But losing that abdominal fat is really going to improve your testosterone levels in itself. Even when you start testosterone replacement therapy, if you have to, with less abdominal fat, it's more effective in your body. So just be very cognitive of that. And if you need help or you have questions about that, I'll be more than happy to talk to you about that. And just remember that testosterone is a powerful hormone that our body needs, but it's not the end all of all. Maybe there's something else going on with you. Maybe it's not your testosterone. Maybe you truly are going through a period of depression, or maybe there's something going on with your testicles that you have no control over, or maybe there's something going on with like your blood pressure, and you've just not gone for your screening, or been to the doctor in a year, so you don't even know that your blood pressure is high. That's the reason why it's so important for us to go and get tested frequently. Go to the doctor, find somebody that you like, and go and get screened frequently, like your blood pressures, your cholesterol, those sorts of things, because it's so important that you maintain your health, especially your testosterone. And even though low testosterone is about your identity, or a lot of male feel like it's their identity. Of course, it ties back all into the sexual capabilities of the man, because that's what y'all identify with. Y'all are the sexual lovers. So if you're not able to perform, then you feel less of a man. But there are tools here, there are providers out there that want to help you, and you just need to jump on board and take charge of your health and go, hey, I'm going to go get tested today before 10 o'clock in the morning. Okay. There are places out there, I'm going to say it and hark it almost every episode that I'm going to talk about on testosterone. There are places that will test it at 2:30 in the afternoon. Again, that is not a clear picture of who you are. Okay? I said it first. I said it here. I'm not ashamed to say it. I'm just truthful. And if you find those places and they go, hey, we can go ahead and test your testosterone at 2 o'clock in the afternoon, I'm going to need you to get up and walk out the door. Don't give these people your money. Just don't do it. Okay? Take my advice. So you just need you need to treat it. Test it, treat it, and feel better. And get that balance in there that's going to make your life a lot better. Take charge of your health, man. Do yourself a favor, do your family a favor. And longevity is, we're living longer, and longevity is what we all want. But if you don't have the quality of life to go with the quantity, what's the point? So in episode 3, we're going to talk more on testosterone. Yay. Testosterone is a big subject. It can take a lot to kind of talk about it, but I don't want to bore you to death with a 45-minute episode. So we're going to talk more on testosterone and what you can do as a male or a woman, if you're listening to this. Thank you. What you can do to manage your testosterone. And some of that is going to include some mental health. So let's all just gear up and get ready. And thank you for watching and unmasking more testosterone. with me, Shelly, your host. So I'll see you in the next episode. Have a great day. Thank you.